Factors that affect performance testing. Athlete evaluation are interpreted in relation to several factors. When comparing athletes to one another, or when comparing the performance results of a single athlete, the strength and conditioning professional must understand that the test results are influenced by several factors. These may include body size, fiber type composition, training status, and testing selection. Specifically with testing selection, we need to discuss the specificity and relevance of the test and validity and reliability of the test. The first one, body size. Usually, larger athletes are stronger than smaller athletes. So strength is positively related to body size. This is absolute strength. For sports that do not have a weight class, absolute strength is an appropriate way to compare athletes. However, sometimes reporting strength relatively to body mass may be appropriate, especially when comparing athletes of varying mass on strength and power performance. Your definitions of absolute strength versus relative strength are on your slide. Greater strength, greater absolute strength will improve your overall relative. Relative is simply taking your body weight into account. Strength versus power. Strength is measured in newtons, the ability to exert force, versus power. Power equals force times velocity. So strength is force, and power adds the velocity component. So an example, if we have an athlete or two athletes who jump 27 inches, which athlete is more powerful? Based on jump height alone, one may assume that both athletes have similar lower body power. However, if power relative to the person's body mass is examined, then the heavier athlete was much more powerful. The heavier athlete jumped the same distance, but with a heavier load. So power equals a greater force times the same velocity. If you recall, power again is equal to force times velocity. The greater weight, i.e. force, resulted in greater power development. If you're heavier or an object is heavier, we need more velocity to go the same distance. The way the data is examined can result in two substantially different outcomes. Second one, fiber type composition. We have two different types of fiber for skeletal muscle. Skeletal muscle is voluntary, meaning we need to cognitively send a signal from our central nervous system to the skeletal muscle for contraction to take place, for force to occur. The contractile properties of muscles play a significant role in their ability to generate force, sustain performance, and delay fatigue. Athletes with a higher percentage of fast twitch fibers have the inherent ability to produce greater force and faster contraction velocity. This includes type 2X and type 2A. The trade-off of this, however, is fatigue. They fatigue at a faster rate because they provide higher force and faster velocity. In contrast, athletes who have muscles primarily composed of the slow twitch fibers have a slower rate of fatigue, but the trade-off is that they do not perform as well on strength and power assessments. These athletes will find more success in aerobic endurance sports. Athletes have very little ability to significantly alter their fiber type composition. Fiber types will be based primarily off of genetics, but also some training. There can be some trade-off between the two. However, genetics play a huge role in what each individual has as far as fiber type composition. Training status. Training experience of the athlete determines to a great extent the magnitude of potential performance improvements. The greater the training experience, meaning more experience the person has had with a specific training protocol, the smaller potential for achieving performance gains. For instance, if we took LeBron James and we wanted to train him for his jump height, could we enhance his jump height significantly right now? Probably not, because he is already trained and he has already reached or close to reaching his genetic ceiling, meaning he can't go further or improve a whole lot more in his ability of his performance. However, those who have never trained a day in their life or has a younger training age has a greater capacity to improve in performance. But over time, if they continue with the training, they become more experienced and therefore get closer to their genetic profile, their genetic potential. And improvements in responses to training will slow. So, can we improve elite athletes? Sure. But they may be small gains, yet still significant. Test selection. The selection of testing is generally based on the relevance of each particular fitness component within a particular sport. A specific testing may include strength for the upper body, the lower body, power tests, and also assessments for speed and agility. In addition, cardiovascular, endurance, body composition, and flexibility may be included. When developing athletic assessments, the appropriate test battery is initially determined by the needs analysis of the sport. We need to make sure that it's specific and relevant to the athlete and the sport. For performance, it is imperative that we use similar mode of exercises, for instance, squats. Testing results can accurately reflect the magnitude of strength improvements. However, if testing and training are performed on different training modes, for instance, machines versus free weights, the actual magnitude of strength improvements may not be seen. So we need to be very specific, which brings us to the validity and reliability. Validity means the degree that each test measures what it is actually intended to test. This is key. We want to make sure our tests are actually measuring what we want it to measure. And reliability is the ability to test and consistently repeat the same results. Therefore, it is possible to have a test that is reliable but not valid. For instance, a scale. If we step on the scale, it could read the same number over and over and over. Yet, if it's not calibrated, it may provide a false number. Therefore, it is invalid. It is, again, imperative that the test is valid and reliable. Practical considerations for test administration. To attain accurate assessments, tests need to be administered safely and in an organized fashion. Assessment timing should be carefully planned, and the test should be administered in a proper sequence. In addition, all athletes being tested should have a clear understanding of the purpose of each test. So let's go ahead and dive into these 4 practical considerations. 1. Safety considerations. Medical clearance. All athletes, regardless of the level of competition, should be medically cleared by the team physician or sports medicine team associated with the facility. The goal is to make sure that they are ready for an exercise program. It is the responsibility of the strength coach as well as the team coach to ensure medical clearance has been obtained. It is highly recommended that the issue of medical clearance be included in the operational procedures for the facility. Timing of assessment. It's important to test at the appropriate time. For instance, not during season. This would not be an appropriate time. The reason for this is to maximize the information provided by the assessment programs, making sure it's valid and reliable. It is imperative that evaluation periods are conducted throughout the training year with the goal may be slightly different, depending on when the assessment is taking place. To assess the physical readiness of the athlete to participate in a competition season, testing should occur at the onset of training camp. Novice or new athletes who are being evaluated prior to the beginning of a fitness program should be allowed sufficient time to learn how to perform each test. You have to take into consideration the learning curve for each movement. This will allow the athlete to perform each test safely, resulting in a more accurate assessment and more effective exercise prescription. This figure shows an example of specific testing periods throughout the training year. This testing schedule is an example of a collegiate American football team with a competitive season lasting from September to November. Test sequence. One of the most important administrative concerns is the order in which the testing takes place. Tests that are requiring high-skill movements, such as agility measurements, should be performed prior to any fatiguing tests. Any performance tests that fatigue the athlete will confound the results of any subsequent tests. Therefore, here is the order. That power should be done prior to strength. Conditioning should be done last. Strength before endurance. And ideally, the battery of tests should be conducted on different days, if at all possible. Interpretations of results. Once testing is complete, the information obtained must be communicated to both athletes and, when appropriate, to the sport coach. Individual results can be compared to previous results to evaluate the progress in the team's conditioning program. Performance results can also be compared with those of other athletes playing in the same sport and position to assess the athlete's potential. Results can also be used to prescribe exercise, develop training goals, and also motivate athletes when communicated properly. It's also important to interpret the results correctly, as they will be your baseline measurements, and also our realistic goals are put in place. Tests for needs assessment and program evaluation. The remainder of this chapter discusses tests that are common to each of the performance variables. Again, those performance variables, the choice of exercise, intensity, order, volume, rest. It is not meant to be an all-inclusive list of potential tests. However, the discussion focuses on tests that are widely accepted and used. Strength. Test selection. What exercise to actually use? So when assessing strength, we must decide which type of exercise to use and whether to test maximal or predict from a sub-max test. In regard to test selection, they must remember the importance of specificity. We must mimic the movements that the athletes complete on the field. The test should be part of the athlete's resistance training program to see improvements over time. As mentioned previously, this will allow a clear understanding of the effectiveness of this conditioning program and provide a true measurement of the athlete's ability. We need to focus on large muscle groups, for example, squat, deadlift, bench, power clean, vertical jump. The type of strength training is going to depend, again, on the sport itself and what the athlete really does. Are they dynamic? Are they isometric? What type of equipment would be beneficial for the greatest transfer of effect over to the field? Again, another benefit of using exercises that are very specific and mimic to the athlete's program or movement within the field, it's going to also help ensure proper technique, thereby reducing the potential for injury during testing, during exercise, during performance, and also maximize efficiency of the movement. Isokinetic testing. In some cases, an exercise that recruits smaller muscle may provide additional information. So isokinetic testing is done in a lab, but it can potentially indicate weakness in specific locations of the body. This laboratory piece of equipment isolates and focuses on smaller muscle groups or allows only one muscle group to fire at a time, as opposed to a squat that requires quads, hamstrings, torso strength, total body awareness. Whereas this image is utilizing and isolating the quadriceps on the way up during knee extension and hamstring strength on the way down during knee flexion. So therefore, it forces the body to produce a rotation around its axis and seeing the strength at that point. Dynamic consistent resistance testing. The use of dynamic consistent resistance exercise performed with free weights is the most popular mode of strength training. It is also the best way to mimic and stimulate movement patterns from the field to the weight room and then back to the field. The issue that is frequently encountered is whether to directly test one repetition maximum, 1 RM, or predict maximal strength from the number of repetitions performed with submaximal test. Often this is based off of practicality. For instance, testing large groups. When testing large groups of athletes, when it's often the case, time is an important and valid concern. Therefore, a 1 RM may not always be applicable or practical. That said, no literature supports this above statement stating that a 1 RM leads to greater risk of injury. When appropriate loads are used, certified professionals and spotters are present, and the athlete knows how to do the lift correctly. A 1RM test retest reliability is really strong, meaning the reliability R is greater than 0.90 on a scale from 0 to 1. Meaning, so this is really strong, meaning we could implement a 1RM test and have valid reliability that if we did 1RMs over and over, we would get the same results. One RM testing. Here is the protocol for max strength if someone wanted to complete a 1RM. Steps 1 through 9 are listed here for you. This is provided by the National Strength and Conditioning Association, NSCA, and is highly and widely accepted as the normal protocol to attempt to find a 1RM testing. Now, if testing is not successful in step number 8 and 9, you should do no more than 3 to 5 tests to achieve your 1RM. If you go over the 5 sets, it is best to rest and come back on another day and retest. There are equations that we can utilize if someone does not know how to do a 1RM or does not have the strength to do a 1RM. For instance, novice lifters may not be able to adequately and properly lift. Therefore, a 1RM might not be practical. We can have them do a 3, a 5, or even 10 RM and plug it into the equation, which is below in table 2.1. But it is not recommended to do more than 10 repetitions, as these equations lose their validity in determining a max strength for programming. Anaerobic power and anaerobic fitness. Anaerobic power can be assessed in both laboratory and field settings. For most strength coaches, the ability to work with a human performance laboratory is actually limited. However, here at TSU, under normal non-COVID situations, if a strength and conditioning coach wants to do testing with the athlete, our department would gladly assist. Why? It is an opportunity that presents itself where a human performance lab allows for greater sophistication and sensitivity in the athletic assessment. So they will be able to potentially get more information for appropriate programming. So we're going to be discussing how tests in the lab and field can be used to assess anaerobic power and fitness, and also be able to describe the athlete's potential within high-intensity exercises during a game. So, for instance, seeing how high a basketball player can jump provides information to help determine his potential. Yet, it does not provide any information as to whether the athlete's physical condition is good enough to play basketball. There's a difference. Anaerobic power provides information about an athlete's potential, whereas anaerobic fitness describes the athlete's ability to perform high-intensity exercise for that prolonged duration of time, for instance, that game. This isn't 100% fail-proof. Think of recruiting talent. Whenever we have recruiters, do they recruit the best athletes 100% of the time? No, it's a guess. So this testing helps reduce the guessing likelihood of error. Anaerobic laboratory tests. Anaerobic power can be evaluated through sprints on a non-motorized treadmill, repeated jumps on a force plate, or even a contact mat, and maximal effort cycle tests. So these are a variety of field and laboratory tests that can be used to assess anaerobic power. These tests assess peak power, which is the highest power output attained during tests, mean power, which is simply the average, or even both. Additionally, fatigue rate, which is the athlete's ability to maintain power output throughout the duration of the test. This can be measured through the gold standard known as the Wingate anaerobic test. It is a 30-second maximal effort against resistance on a stationary bike and is demonstrated in the next slide that you can see an image of what it looks like. Why is it important? Fatigue rate value highly correlates with fast twitch fiber. The Wingate anaerobic power test is the gold standard in our field for a laboratory test. Athletes who are trained for aerobic endurance generally have a lower fatigue index. The figure demonstrates a sample performance diagram produced from a 30-second Wingate test and demonstrates how power output over the course of 30 seconds drops, meaning an anaerobic athlete and a power athlete will have a significant drop in power over time. The slope will be much greater as opposed to someone who is aerobically trained. They'll have a flatter slope because their fatigue index differs. The profile is going to be different. The drawback of the Wingate, one, is that it's in a laboratory setting, and then it's difficult to be able to do the test. There can be more specific tests that provide a better understanding of the athlete's current status and a reflection of the sport. For instance, a vertical jump anaerobic power test does have a greater sport specificity, especially for basketball and volleyball. Anaerobic field tests. When testing large groups of athletes, which is typical in a collegiate setting or school setting, equipment availability and the fact that only one subject can be tested at a time in a laboratory may preclude the use of any of those previous lab tests mentioned. As a result, most strength coach professionals use field-based tests to provide similar assessments to obtain similar variables such as strength, power. The vertical jump is a popular test, as similar to the 30-yard shuttle as well as the line drill. The vertical jump, the drawback is that you only are able to get jump height unless lab equipment is used to measure force, power, or velocity. But there are some scientific equations that can help. If you are looking for mean power or peak power during a vertical jump, these equations can be used to estimate. Now, I am not expecting you to memorize these equations by any means, but they are a good resource for you to reflect back on if you need to measure peak or mean power of an athlete. The 300-yard shuttle is a field test often used to assess anaerobic capacity. Following an adequate warm-up, the athlete lines up at the starting point. At the signal, the athlete sprints to a 25 yards away and then returns to the starting line. A total of 6 round trips are performed. The line drill is very similar to the 300-yard shuttle, which is known also similar to suicides, which might be more sport specific. A fatigue index is generated by dividing the fastest score by the lowest score, which reflects the fatigue index test on the previous slide, if that is something that is critical for the strength and sports coach to know. Aerobic capacity and aerobic endurance. Success for athletes in aerobic endurance sports such as cross country, skiing or running, swimming, cycling often depend on large aerobic capacities. Although many factors determine aerobic performance, such as our capillary density, mitochondrial number, muscle fiber type, our lung capacity, what is important is the maximal aerobic capacity of the athlete. VO2 is simply the oxygen we take in. Maximal aerobic capacity, VO2 max, is the greatest amount of oxygen we can take in and utilize during exercise. These numbers range from 0 to 100. Now, resting VO2 is from 3 to 12 milliliters per kilogram per minute. Aerobic athletes range from 40 to 60. Average individuals is between 20 and 45 during exercise. You can measure VO2 max directly or indirectly. It can also be used during field tests, such as the Cooper test, to be able to measure an estimated VO2 max. Let's talk about how we can directly measure and also indirectly measure these. Direct laboratory assessment of aerobic capacity is best measured when using a treadmill, as it has been shown the greatest results. Measuring VO2 max is done utilizing a step or a staircase-like approach on the treadmill, meaning you increase the miles per hour from a low 1.7 as illustrated in the figure on top, and overall increasing it roughly a mile to mile and a half every few minutes, and increasing the grade, the incline of the treadmill at the same time. The test usually lasts roughly until or around 15 minutes. And 3 of the 4 of the following must be met to determine if VO2 max has been established. Now, these are more for exercise physiology, but it's still important and still good to see this over and over for future reference. Again, the impact or the need for this is to determine maximal aerobic capacity to establish the aerobic base for an athlete. A couple of numbers for reference. Resting VO2, meaning how much oxygen are we utilizing right now at rest. That's roughly between 3 and 12 milliliters per kilogram per minute. During exercise, we take in more oxygen, therefore these numbers will increase. For someone who is recreationally trained, these numbers vastly vary, but on average, between 25 and 45 milliliters per kilogram per minute. Elite anaerobic athletes range from 40 to about 55 milliliters per kilogram per minute. And aerobic elite athletes are typically above that 50% or 50 milliliters per kilogram per minute marker. Lance Armstrong, for example, was in the 60s for his VO2 max, which is incredible. It can range from, again, 0 to 100%, but we do not utilize 100% of our lung capacity. Therefore, it's never going to reach 100%. Similar to anaerobic tests, we can measure submaximal work. So instead of directly measuring VO2 max until fatigue, we can utilize a test that only requires the athlete to reach submaximal levels and then utilize an equation to estimate VO2 max. Similar step protocols are utilized in this approach as it was in number 1 for direct laboratory measurements and the staircase effect. Again, an equation is not required for you to memorize, but the following formula that is below in the notes may be appropriate to use if you have an athlete and you need to determine VO2 max. An easy field test and popular, well accepted test known as Cooper. Completing a 12-minute run to estimate VO2 max. This is utilized typically in larger groups of athletes and more feasible to administer as opposed to going to a lab and testing everyone one by one, just like the Wingate. Your VO2 equation for the field equation is below. Again, you do not need to memorize this, but it's good for reference. A single track lap equates to 400 meters. Therefore, 6 laps equals 2,400 meters. So if using the formula above to estimate VO2 max, and it's 53 milliliters per kilogram per minute. That's an example by implementing the equation above. 53 milliliters per kilogram per minute is the amount of oxygen being used during the field test, which is a very good result for VO2, especially if it's for a recreationally trained individual or even a beginning of an elite athlete. The drawback on this is that the estimation of run, especially if the athlete didn't complete a full set fraction of a lap, because it is only 12 minutes, at 12 minutes you must stop and then determine the exact distance the athlete ran. Speed of movement. So there's 2 definitions. Speed, which is the ability to perform a movement in as little time as possible. And then there's performance speed, the ability to perform a movement with optimal technique in as little time as possible. So why is this important? If you win, does it really matter how? Well, yes and no. If you have optimal technique, more efficient utilization of the physiological system, meaning we may use less energy for the same movement. Therefore, you can recover faster and less likelihood of injury. So if you have a novice lifter or a novice athlete, the goal should be to teach them how to move optimally with correct technique. Now, again, if you have LeBron James and he isn't as efficient with a movement, is it beneficial to have him change the way he jumps, change the way he moves to improve technique? At his level, probably not. So it depends. Testing for speed. You can utilize 2 different ways. Stopwatches, which is pretty easy. You only need a stopwatch in a track and field area. And then you have an electronic based timer, which starts and stops with a laser as soon as you measure or run through the piece of equipment. Typically, stopwatches are slightly faster than electronic measurements, largely due to human error. So if possible, you always want to try to utilize an electronic device, as it is precise and has demonstrated that it is reliable and valid. Talked about speed, and now we're going to move into agility. Agility defines as the ability to change direction rapidly. So agility means to have the ability to change direction rapidly. It is a common variable measured during most athletic performance testing. Like speed, is relatively easy to measure, and all that is needed is a stopwatch and some cones. There are a number of different agility tests. These are just a few that your textbooks provide that we have. So the t-test. We want to arrange 4 cones as seen in the image above, where we have 10 yards between A and B and 5 yards between B and C and B and D. You run this starting from A to B, they move over to C, and then all the way to all the way to D, and then the time stops. The entrance slide test is a 12-foot wide floor that's divided into 4 3-foot spaces or sections using 5 different lines. The athlete will straddle the center line. On the go command, the athlete will begin to run in both directions. The pro agility test. It is known as a 20-yard shuttle. The test is often performed on a football field, but it can also be performed on any marked field or place where there can be lines or cones used every 5 yards. The Illinois test. 8 markers are used for this. 4 of the markers are used to form a rectangle, and 4 are placed on opposites or on either side of this rectangle. When approaching the starting position, the athlete veers diagonally to the left and enters the agility course consisted of 4 markers in the center. The athlete runs in a zigzag, weaving around the obstacle. When he reaches the end of the course, the athlete will turn around and perform the same pattern back to the starting position, weaving through the last marker, and the athlete makes a U-turn to the left and sprints towards the C marker. Then finally a U-turn and sprints towards the D marker. Now, on the exams, I am not expecting you to remember exact patterns of these, but possible recognition of each test. If I provided a t-test picture and gave you all 4 names, could you tell me which test is which? Another component of evaluation is body composition. There are a number of ways to determine body composition, and it's important to be able to understand what you're really measuring. So body composition generally reports the percentage of body weight that is fat. The range in body fat percentage varies among different athletes and is relatively primarily to specific demands of each sport. Aerobic endurance athletes or gymnasts are generally on the very lean side, but football players, primarily linemen, may be borderline obese. A number of methods can be used to assess body composition. There are gold standards, and there are also ones that we can utilize that are not as high-tech but are useful and still valid when done correctly. DEXA, D-E-X-A, stands for Dual Energy X-ray Absorptiometry, has become a new gold standard, but it's an X-ray. that L bar that you'd see actually scans the person who is laying down and provides body fat as well as fat mass, lean tissue mass, and bone density to determine body composition. The major drawbacks of a DEXA measures of the cost and operation. It takes someone who is certified to run a DEXA. The bipod, you can see the individual sitting inside. Minimal clothing is required for this, typically tight clothing as well. It measures the space that is utilized inside the bipod. We have one of these at TSU in the HPSS department. Hydrostatic weighing, you sit in a chair and they lower you into the pool and you duck your head under and breathe out as much oxygen as possible in the lungs. This measures the displacement of water, so you need to remain as still as possible while trying to do so. It can be very difficult. Testing may need to be done a couple of times. Skin fold and bioelectrical impedance are easier to use. We'll talk about skin fold on the next slide, but the bioelectric impedance are electrical sound waves that run through the body to measure body fat. We have the handheld one and also the stand that looks like a scale at TSU. Typically, if you're more hydrated, this measurement comes back faster, which may skew the results a little bit in your favor, demonstrating or showing that you're not as heavy as if you were dehydrated. Let's go to the next slide and talk about the skin fold measurement. Skin fold equations and body fat percentages differ between males and females. You can do a 3-site or a 7-site, and you just plug it into the equations that you see on your slide. Again, you do not need to remember these equations, as you can always look these up. But you do 3 sites versus 7 sites, and you can see the different sites of location where we would pinch the fat or pinch the skin of the individual. You do not do this to yourself because you typically do not get the correct results. So you will usually have someone else measure the 3 or 7 sites for you. The picture or table to the right gives you an average conversion of body density to body fat percentage for equations, and it can be based off of population as well. In summary, an assessment program can be used to examine the effectiveness of training programs, evaluate athlete potential, and develop training programs and set training goals. To maximize the effectiveness of an assessment program, the test must be reliable and valid. The validity point is the most crucial. Therefore, it must be provide a relevant information to both the strength and conditioning professional as well as the athlete. Testing should be developed based on the needs assessment, the needs analysis, metabolic, biomechanical, and other demands of the sport. And lastly, concerns for the test administration include the order of tests and timing of tests. These variables must be adjusted to allow athletes to perform the best to their ability and provide information that is important that will maximize their overall performance during the competitive season.